Kiha Kolomosi, Ninjusinzi Kikai Wapalaniwe Manato, Nunji Lamawo Wanjikil Wak Lamawo Tekwa, Anishi Kishalo Mokwen, Elamilian Yongkwai Kishkwi, Wak Kukana Aki, Wak Tenda Wak Mbi, Wakilongo Mati, Wak Nimbu Mouse Wakanam, Anishik, 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 Anishik. Thank you, Creator, for giving us this day, our Mother Earth. We thank you for the fire and the water. We thank you for all of our relatives, and most importantly, we thank you for our lives.
Hello everyone, my name is Judith Zelikoff, and I'm here to talk to you about the data that we collected working with in equitable partnership with the Ramapo Turtle Clan. First slide showing you that we're working with the NIH, who is funding this research, on a research to action grant with the Ramapo Lenape Nation, and we have formed an alliance called the Ramapo Lenape Nation NYU Health Action Alliance. And along with the team from NYU, that includes my coordinator, Jill Aquino, Shannon Dougherty Lyons, who's the research scientist, Tri Yun, who's the doctoral student on this grant, and Maite Salim, who is our master student, all working on this project. What is this project? So the Research to Action project was supported and funded by the National Institute of Environmental Health Sciences in 2022. It's a 5-year grant in which NYU, as well as the University of New Mexico, partnered with the Ramapo Lenape Turtle Clan to bring together a culturally centered environmental roadmap to create community input to bring about food sovereignty and sustainability by partnering with the Muncie Three Sisters Medicinal Farm that will lead to partnerships and hopefully work with other environmentally impacted tribal nations. So let's get a little background first before we go on with the data that will talk to us about Native Americans and their environmental health toxic legacy. So American Indians born today have a life expectancy that's about 14 years less than all other race populations in the United States. And in addition to their suffering many horrific quality of life issues, Native Americans face great challenges of disproportionate hazardous environmental exposures. Unfortunately, nearly 25% of all U.S. Superfund sites, which are waste dumps, are in Indian country, and about 400,000 Native Americans live either 3 miles or less than 3 miles from a waste site, a Superfund waste site. And about 48% of households of Native American reservations don't even have clean water or adequate sanitation, which is very scary. 61% of all industries that exist on tribal lands have never been inspected for the amount of air and polluted air that they put out. And about 600,000 Native Americans continue to be subjected to large amounts of toxic waste, including their children and pregnant women. And this toxic waste results from living near nuclear test sites, uranium mines, power plants, and toxic waste dumps. The Ramapo Lenape Turtle Clan tribe exists on a Superfund, 500-acre Superfund site, and their toxic legacy continues from the 1960s and 1970s when Ford Manufacturing Plant in New Jersey, Mahwah, New Jersey to be specific, and the local town government of Ringwood used the abandoned mines for disposal of toxic waste. To be specific, 25 million pounds of paint sludge was buried underground in an abandoned mine in Ringwood, New Jersey, which the Ramapo Lenape Turtle Clan have lived for centuries. The mines were listed as a Superfund site in 1984 because of the dumping by Ford. They were taken off the list and claimed to be clean, and then relisted in 2006 because there wasn't complete remediation or cleanup of the site. Because of self-reported health concerns facing the tribe, our NYU program was asked in 2013 by Chief Mann and one of the leaders of the Turtle Clan, Vivian Milligan, at a local powwow if we could help. So one of the first things that we did was put together a community advisory board that was established in March of 2023. We meet monthly at the Church of the Good Shepherd in Ringwood. It consists of a number of community members, and they help us with survey recruitment, community engagement. They serve as citizen scientists, and they provide guidance and direction for all of our initiatives. We've had environmental sampling done there, and soil and air samples were collected from 6 zones that were increasingly further away from the original dumping site, which was at Peter's Mine. We tested for the presence of heavy metals in the soil and in the air, and benzene was also tested in the air. We collected soil samples thanks to all of our citizen science from Ringwood who worked with us to get this job done. So what do we see? Lots of metals, and some which are higher than the EPA standard. And the EPA standard is set to protect human life and health. And what we found was that in some of the zones, there was very high levels of arsenic, which was above the EPA standard of 0.68. Some of the zones had as high as 24.8. We found benzene in the air. The EPA standard for benzene is 0.36, and we found an average level of benzene in the 6 zones of 7.2. And in one zone in particular, closest to the site, we found a level as high as 11.7. Why is this important? Well, there are a number of health effects that are associated with elevated long-term chemical and metal exposures. For example, arsenic is associated with cancer, with diabetes, hypertension. Hypertension is associated with arsenic exposure, as well as cancer, diabetes, and numerous skin problems. Benzene, which we found at high levels in the air, is a known carcinogen or cancer-causing agent, and it also affects blood and causes blood disorders, mental health disorders, and suppresses the immune system. Cadmium causes cancers, hypertension, lung disease, and lead, which is known to cause hypertension, kidney disease, and neurological disorder, and is suspected to be a carcinogen. So to get started in really better understanding the health implications of the Ramapough as a result of living on a 500-acre Superfund site and close to it in some capacities, we established a community health survey. Took several months, if not a year, working with the community to help develop this. We launched it after thorough prototyping and distribution to some of the members that served as a focus group to review this. One of the things that we looked at in the survey or queried about were demographics. There were a total of 140 participants to date. We're still collecting surveys, not only from the Ramapough, but from non-Ramapough who live in Ringwood, New Milford, Wanacue. So we hope to get at least 200 Ramapough as well as non-Ramapough members. So we identified 104, or they self-identified. The participants self-identified as Native Americans, and there was 104. 95 of the survey respondents belonged to the Ramapough Lenape Turtle Clan, and others claim other Native American ancestry. There were 99 women and 41 men, which is not unusual for surveys. For some reason, it seems to be that the women are more interested in communities of taking the survey. We have 86 people currently reside in Ringwood, New Jersey, and our age range is from 18 to 86, and we have an average age of filling out the survey of 53 years old. We also came up with community health survey questions. We did a health assessment. We wanted to know what people have been diagnosed with, since there's been no real report on health since a 2016 report by the Department of Health of New Jersey, which was done through hospital records, which could be biased due to the fact that many of the Ramapo do not have health insurance and probably did not go to the hospital, so it could be an underestimate. But we did our surveys one-on-one, face-to-face, or online, and then checked out the credibility of those surveys one by one. Survey participants were asked to indicate from a list of 78 different health conditions, such as diabetes, cardiovascular disease, cancer, stroke, for which they were doctor diagnosed. And from that, we determined the most commonly diagnosed health conditions in the community. And combined with answers to other sections of the survey, we determined the prevalence of different health outcomes in the community. So from the survey, we were able to define the top 10 reported diagnosed health conditions for all Native and non-Native survey respondents. We found that the top of the diagnosed health conditions was hypertension, but it fell in the U.S. national prevalence of 48%, whereas those surveyed were around 50%. More surprisingly, however, was asthma and allergies. So the U.S. national prevalence is 7.7%, but in those people taking the survey, they had 42.1% prevalence. Also for allergies, the U.S. national prevalence is 25.7%, and in the community that were respondents, it was 42.1%. Also of great interest is that the U.S. national average for bronchitis is 3.6%, but in our respondent population, 27.1% of the people said that they had bronchitis, quite high. As well as eczema, which had a national average, national prevalence, I should say, of 9.1% versus 22% in this community. And finally, anemia, which was number 10 of the reported diagnosed health conditions. 9.3% is the U.S. national prevalence versus 22.1% of all respondents claim to have doctor-diagnosed anemia. Now, when you take Native Americans only, and that was 104 respondents, versus non-Native Americans, which were 36 respondents, the top 10 health conditions with the largest difference in prevalence between Native Americans and those of other races include hypertension, asthma, allergies, obesity, diabetes type 2, eczema, excessive tooth loss, and uterine fibroids. Of great interest is that non-Native Americans that were interviewed, that were surveyed, 36 residents, which is a small number, doesn't carry a lot of weight. However, it suggests with non-Native Americans having no incidence of uterine fibroids, but Native Americans having 16.7% of all 104 respondents claim to have been diagnosed with uterine fibroids. Asthma and diabetes type 2 were the most disproportionately diagnosed health conditions, meaning the difference between that number found in the Native Americans versus that found in non-Native Americans. Again, when we analyzed the data and looked at Turtle Clan members, which were 95 respondents, versus members of other tribes, other clans, and non-Native Americans all put together, the Turtle Clan members showed to be more commonly diagnosed with thyroid cancers than were any other survey respondents. So what do these data tell us? The survey results showed that Ramapo members had a significantly higher prevalence of certain diseases than non-natives in other demographic groups. That asthma, diabetes, eczema, hypertension, thyroid disease, cancer are significantly higher in the Ramapo members. Based on this small but scientifically sound data set, there's our reason to believe that exposure to residual contamination from previous dumping could now, 2025, impacting the turtle clan's health. The turtle clan also asked us way back if we could help them with knowing whether they were actually exposed. So we did blood and urine collections, and we also did what's called biometric measurements, where we measured the blood pressure, height, weight, determined body mass index, and waist circumference. Our biomeasurements were completed on all tribal members who were enrolled for blood and urine because we wanted to be able to inform them with health promotion strategies, community actions they could take. So again, we looked at waist circumference, which is a big indicator of fat, not only on the outside, but also on the inside and on the internal organs. We looked at height and weight, and we came up with body mass index, both for women and men, and blood pressure. So in this case of biometrics, we had, again, the majority of participants for the biometrics was 69% of the females and 31% volunteering blood and urine, as well as participating in the biometrics. 31% were male. As seen in the survey, more women are participating. According to the biometrics, the average age of biometric participants, for males, the average age was 57.5, for females, 54. So we had a middle-aged to a little older demographics in terms of age. As I said, the waist circumference was also measured, and waist circumference screens for possible health risks linked with overweight and obesity, because if most fat is around your waist rather than your hips, you're at a much higher risk for heart disease and type 2 diabetes. And as I stated before, when you have higher waist fat, you also have you can also have organ system fat around particular organs. So a larger waist, to sum up, a larger waist usually also means there's excess fat inside your organs. And these data all came from the National Heart, Lung, Blood Institute, the NIH, and the National Institute of Health. So what did we find? What we found was for males that the waist circumference in adult, and there is a chart for that from the National Institute of Health, indicating the range of the weight of the waist circumference, and we found that males were considered very high in their waist circumference, and that females actually were considered very high in their waist circumference. Again, leading to the possibility of a higher risk for heart disease and type 2 diabetes. Our body mass index, BMI, as is commonly known, is a medical screening tool that measures the ratio of your height to your weight to estimate the amount of body fat you have, and BMI is very important. It's a quick and easy way to estimate body fat and assess your risk of health problems associated with being overweight or even underweight. And interestingly, although shockingly, adult American Indians are 50% more likely to be obese than non-Hispanic whites. And overweight adults in general are more likely to suffer from high blood pressure, high blood fat levels, diabetes, and elevated low-density lipoprotein, cholesterol, and all risk factors for heart disease and stroke. And our Ramapo participants in this, 60% of all female participants were classified according to the BMI chart as between moderately obese and severely obese, and 53% of all the male participants were in the same category. Let's talk about blood pressure, which is another biometric, and high blood pressure, as often known as hypertension, is when the force of blood flowing through your blood vessels is consistently too high. You have two measurements, and this is based on the American Heart Association categories. You have systolic, which is the top number, and diastolic, which is the bottom number. And according to the American Heart Association, there are basically 4 stages. One is normal, when your systolic is less than 120 and your diastolic is less than 80. Then you can go to high blood pressure or hypertension, stage 1, where your systolic is 130 to 139 over 80 to 89. Stage 2, which is also considered high, greater than 140 systolic or greater than 90 diastolic. And then finally, stage 3, which is systolic greater than 180 and diastolic being greater than 120. So why is blood pressure so important? Because there are a number of health threats that come from having high blood pressure, including strokes, vision loss, heart attack, heart failure. So where do the Ramapo fit into this? Unfortunately, the average blood pressure for women is 138 over 88, which is considered stage 1 hypertension. And the average for the men was 150 over 93, which is considered stage 2 hypertension. So this information is extremely critical for each participant to take to heart and to recognize that they should consult their healthcare professional and have their blood pressure taken repeatedly. So what about the blood and urine collection, and how did they turn out? So one of the things that we measured was vitamin D, and vitamin D is extremely important for teeth, bones, calcium levels, cell division, immune system to function properly, building muscle. Okay. Also, vitamin D helps to prevent certain diseases like multiple sclerosis, heart disease. It keeps your immune system functioning properly so that you don't have increased numbers of respiratory or infectious diseases. Vitamin D can also help regulate your mood and reduce depression, and supports weight loss. The recommended blood level to be from the NIH is between 30 to 100 nanograms per mil. So how did we fare with vitamin D and our participants who had blood and urine? So vitamin D levels in the blood were measured as stated, and the levels that again are standard or optimal or desirable is between 30 to 100 nanograms per mil. So unfortunately, 56% of all participants, male and female, who had their blood collected had below the desirable optimal range. So the average for those people who had their vitamin D levels measured was an average level of 30.1 nanograms per mil, which is below the desirable level of vitamin D. This means that some of those diseases, increased incidence of infections, bone health, teeth health, all of these things can be negatively affect organ systems and the proper functioning of organ systems. Certain foods were recommended that are rich in vitamin D, like salmon and peas, cheese, mushrooms, corn, and of course eggs. We also measured C-reactive protein levels, which is a protein made by the liver. And when you have inflammation in the body somewhere, you have increased levels of CRP, which is an indicator or marker of inflammation in the body. Unfortunately, the levels don't tell you where the inflammation is coming from, but it does tell you that your body in one or more of your systemic circulation or organ systems is inflamed. And we also have levels that are normal ranges, which is 0.5 to 3 milligrams per liter. Then CRP levels can be slightly elevated when they're 3 to 10. Now, naturally, CRP levels increase with age. And naturally, women tend to have slightly higher levels than men. You can have higher levels of CRP if you have diabetes, if you have periodontal or gum disease. Inflammation levels will increase with smoking, with obesity, and pregnancy. The moderately elevated, which is 10 milligrams per liter over 100, is associated with rheumatoid arthritis, cancer, Crohn's disease. And then if you go over 100 milligrams per liter, that could be due to acute bacterial infections or major trauma. So where do we fall in terms of C-reactive protein, or CRP as it's more commonly known? Greater than 53% of all participants had a value above the normal range of CRP, which again, as a reminder, is 3 milligrams per liter. The average participant level was 6.3 milligrams per liter, again, twice as high. And these are all Native Americans. Okay, so all the biometrics, all of the blood and urine was only done on Native Americans, particularly with higher numbers, the Ramapough Nation. So you can see that there were 47%, which is very good, had normal CRP levels. 31% had 3 to 10, which is above normal, and 22% of the individuals, of the Ramapough participants, had 10 to 100 milligrams per liter. So it's hard to say what this actually means, because many medications that people take can influence your CRP levels, as well as supplements that you take. So one must have this checked again, because it is linked with, as I said, many different diseases. So you have to rule out the supplements, you have to rule out interactions with the medications you're taking, and try to search down as to where this inflammation might be coming from. We also measured in our Ramapough participants and other Native Americans PFAS level, and these are also known more commonly as forever chemicals. 100% of all samples, 100% tested, contained PFAS. The average serum level of PFAS in all Americans, there are probably no Americans that have do not have a PFAS level. So I'll repeat that. There are 100% of all samples tested in the Ramapough Nation and other Native American contain PFAS. Now, PFAS comes from many, many different sources. It's also known as the forever chemical. There probably are very few, if any, people in the United States that do not have some level of PFAS. You can get it by drinking, eating, breathing, because it's volatile and it goes into the air. So waste sites, because it will volatilize, fire extinguisher foams, different electronics, food, fish caught from water that's contaminated with PFAS, fertilizers, biosolids, food packaging, grease-resistant paper, microwave popcorn bags, pizza boxes. They're all coated with PFAS. And of course, consumer products like having your couch treated with a stain repellent, of course, non-stick products like Teflon. All of these should be no-nos in our body, in our diet. There are many diseases that we think are associated with excess PFAS levels. This has only recently been shown, so there are no cause and effects at the moment. However, we have seen with published literature that PFAS can potentially increase liver damage or the chance of liver cancer, increase cholesterol, increase your risk of developing ulcerative colitis, increase the risk of obesity, kidney damage, and kidney cancer. It can suppress your immune system, leading to the inability to make antibodies when you have a vaccination or when you have an infection. For pregnant women, it's absolutely not good, and it can lead to decrease in birth weight, motor problems, and decreased survival of the fetus or the offspring. They feel there's an increased risk of thyroid cancer or thyroid disease, decreased fertility, and increased risk of testicular cancer. So all of these outcomes need more research to actually show causation, but these are some of the things that have been starting to be associated with exposure to PFAS. In the Ramapough, the Ramapough have higher levels of PFAS. There is a chart that has been made again by the NIH indicating levels that are relatively safe. Less than 2 nanograms per mil is considered standard for all Americans. Between 2 to 20 nanograms per mil. So going back to PFAS in the Ramapough community, the majority of Ramapough tested have between 2 and 20 nanograms per mil. And I will go over the chart based on PFAS levels put out by the NIH. Less than 2 is considered to be in most Americans. From 2 to 20 nanograms, between 2 and 20 nanograms per mil of PFAS in your blood, you should see a physician and have your lipid levels in your blood, like cholesterol, low-density lipoproteins, all examined and measured. They suggest that you screen for breast cancer based on this, and 38% of the Ramapough had even higher levels. They had over 20 nanograms per mil. And the recommendation for that is encourage PFAS exposure reduction if there's an identified source of the PFAS. And that, again, as recommended by the American Academy of Pediatrics, have children tested for PFAS levels, and the American Heart Association has guidance for all high-risk adults, and make sure that you have your thyroid functioning test, because PFAS, as I said, has been shown to have associations with thyroid disease. Looking at urinary metals elevated above the U.S. population, according to what we call the NHANES survey, which represents many thousands of people across the nation. And what we found was that cadmium, a known carcinogen, was much higher in the urine of the Ramapough Nation. That total chromium was very high compared to the percentile. So, for example, the mean average level of total chromium in the urine of the volunteers was 7.61 micrograms per liter, and the average across the U.S. is 0.27. Mercury urinary levels in the Ramapough were more than twice as high at a microgram per liter level of 873 versus 370 in the United States. And the nickel, also a known pulmonary carcinogen, almost twice as high as that found in the NHANES survey. Lead also was substantially higher in the urine, 0.483 micrograms per liter versus 0.53 in the U.S. population as a whole. Unfortunately, there are many complications from having heavy metal exposure and measuring it in the urine. With this, we sent letters, private letters, based upon how the person, the volunteer, wanted to receive it, whether it was by email or postal service, or handed it to them, or talked to them on the phone. We gave them back a letter telling them about the results, telling them what they can do in terms of seeing their doctor, and not to change any habits until they've seen their doctors. So what are some complications from heavy metal exposure and measuring it in the body? There's GI problems, kidney dysfunction, nervous system disorders, skin lesions, vascular damage, immune system dysfunction, can't mount an immune response to fight off infections, cancers or viruses, birth defects, and certain types of cancers. So we never leave a report back without giving some simple solutions and prevention techniques that you can use so that you don't become exposed to these heavy metals. First of all, we advise the Ramapough living in Ringwood to never plant in ground because their soil is contaminated. Simple things. Take your shoes off from outside when you get inside. Make sure you and your children wash their hands. Use only raised beds to grow your vegetables. Wipe down and mop surfaces where your children play. And be very careful because children have hand-to-mouth behavior. So they can be taking this soil or something that was in the soil and putting it in their mouths and then ingesting the contaminant. Make sure you clean your pets' feet when they come inside. So that's how you can, simple methods for prevention. What about solutions? Well, make sure that you only eat vegetables and produce from clean ground. You can add sulfur and phosphorus containing fertilizer to reduce lead from moving. Lead and other metals in the soil can mobilize and they can move quite a distance. Use grass, bushes, or lead-free mulch, wood chips to cover what you think may be exposed soil. Check for warning signs. Don't fish in a place where there's fishing advisories or swimming advisories. Consider testing children and their free test kits for lead exposure. Home tests are available for some common contaminants in drinking water. Be aware. Basically, be aware. And what are we as equitable partners of the Ramapo Lenape Nation, what are we trying to help with in terms of interventions? And so whatever NYU and myself, Judith Zelikoff, does, they're all been recommended, suggested by the Community Advisory Board. So they guide our activities. Chief Mann and Mikey, his partner, have started a farm called the Muncie Three Sisters Farm, and in 2022 we had a free farmers market where thousands of pounds of produce were given away for free along with bags, and they gave away squash and zucchini, peppers, onions, tomatoes, chili peppers, and everything was gone. We had 4 free farmers market in the park in Ringwood in July, August later, and October, and they were attended by hundreds of people. And unfortunately, due to extreme weather and what I call climate change, they were not able to have a 23 or 24 farmers market because of infestation, flooding, and drought. We are hoping, and we are very, very much looking forward to a healthy crop this year, 2025. It's going in that direction. They have wonderful things growing, and we anticipate having 4 more farmers markets, either in Ringwood in the park or perhaps at the Muncie Three Sisters Farm. We also do lunch and learns, which include a lunch as well as health knowledge. We've given CPR training, AED defibrillator training. We've had cancer screening, Jijang for relaxation. We've had drumming circles. We've had Narcan training. And all of these were led by experts. So Screen NJ offered cancer screenings in breast, colorectal, skin cancer, cervical, lung, HPV, human papillomavirus, prostate, and genetically linked cancers. They also recommended free clinics if and when it was needed. Our Narcan training was led by Pat Ousterhout, who is a Ramapo Lenape Nation member, and she provided everyone with a personal Narcan kit, as well as education and how to handle an overdose. We also have cooking classes where we get much from the farm, the Muncie Three Sisters Farm. They're led by a chef from the Culinary Institute and a graduate of NYU culinary program and nutrition program. And we make up based on the wants and likes of the class, and we teach them cooking with low-cost but nutritious products. An example of one is butternut squash and carrot soup. We also offer on that the health benefits of using some of these ingredients. Our cooking class have gotten rave reviews. All of our events are done follow up by a questionnaire as to how they like the class, and we've gotten information and qualitative information back. Which cooking class did I like the best? All of them. Would love cooking classes to go all year round. Proud to say I've attended all of the NYU Ramapough cooking classes, and the list goes on. We also had a health fair in 2024 and are hoping to have it in 2025 as well, where we had an ophthalmologist, a grief counselor, 14 different volunteer vendors, took no money for this, and we set up booths outside. We also had a legal aid attorney, Passaic County Meals on Wheels, SNAP-Ed, Hackensack Meridian Health, NYU Dental School, and it was a fun day for all. We even had arts and crafts and face painting and games for the kids, as well as, of course, a nutritious lunch. 83% of all the people said they were very satisfied with the health fair. We also produce newsletters every other month, and for the Ramapough community, and send it out also on Facebook, and in which we recap that which has been done in the previous 2 months. So, what do we have to end with? So our studies, our research action NIH studies, were designed to only begin to evaluate current community safety, exposure potential, and provide unbiased information that can inform the community of environmental and health dangers. We found from our surveys and our blood and urine collections that the Ramapough Lenape turtle clan is a much higher risk than non-Native Americans who live in Ringwood or nearby communities for health, disease, injuries. Such health issues could result from exposure to dumped toxic chemicals, but we really need further studies to establish a cause and effect relationship. Underlying health issues can be addressed through education and access to healthy and nutritious foods, and delivering the tribe away from their food scarcity and back to food sovereignty. That's our major goal. What do we want to continue to do? And also, of course, try to get more money to continue this research. We'd like to reach out more to the other two clans, the Deer Clan, the Wolf Clan, also the Turkey Band. We'd like to do more monitoring of soil, water, and air. We also need to do further in-depth analysis of our surveys and continue surveys, continue our blood and urine collections, and continue town hall report back meetings, of course. So thank you to the Ramapough members, and particularly to Chief Mann, and to the graduate students who all participated in this work, to Vivian Milligan, who is a very good friend of mine, an activist for the Ramapough Nation. Unfortunately, she is deceased, and thank you to everyone.